My name is Charles Alaro, and this is my presentation on vascular dementia. One of the most predictive risk factors for dementia is age. The prevalence of dementia rapidly increases from about 2 to 3% among those aged 70 to 75 years to 20 to 25% among those aged 85 years or more. Unlike Alzheimer's dementia, vascular dementia is more common in men than women. Vascular dementia is the second most common type of dementia, representing about 20% of cases, after Alzheimer's dementia, which causes 60% of cases. However, according to Rizzi, Rossa, and Roras-Cruz, due to the overlaps in symptomatology, pathophysiology, and risk factors, Alzheimer's dementia and vascular dementia are not easily distinguished. Risk factors for vascular dementia, as one might imagine, are similar to many other diseases caused by damage to the small blood vessels in the body. As such, cardiovascular risk factors, especially hypertension, diabetes, hyperlipidemia, and smoking, are highly correlated with vascular cognitive impairment, VCI. Because vascular dementia is associated with lifestyle and overall cardiovascular health, some demographic trends can be identified. For example, in low socioeconomic groups, the rate of vascular dementia increases, as does the rate of cardiovascular disease overall. After the age 75, the prevalence of dementia in the poorest regions of Latin America was higher in other developed regions of the world. This phenomenon tries to explain that low educational attainment leads to diminished cognitive reserve. Similarly, the presence of poor diet and resultant hypertension contributes to higher rates of vascular dementia. In the last 3 decades, Japan vascular dementia, Alzheimer's dementia prevalence ratio decreased from 2 to 1 to 1 to 1. Changes in lifestyle, such as reduced salt intake and treatment of hypertension, and reduced incidence of both stroke and vascular dementia. The concept of a vascular process as a cause for dementia has existed for over a century. During the 1900s, the primary cause of dementia was thought to be caused predominantly by the hardening of the arteries, or arteriosclerotic dementia. Since then, theories on the mechanism of dementia have hovered between Alzheimer's type and vascular. However, most dementias are probably due to a combination of these two types. According to Idacola, community-based clinical pathological studies reveal that the largest proportion of dementia cases have mixed pathology, comprising features of amyloid plaques and neurofibrillary tangles, as well as ischemic lesions. The specific mechanism that causes vascular dementia was discovered with advances in brain imaging technology. As explained by Idacola, the introduction of brain imaging led to the realization that diffuse white matter lesions were a frequent correlate of cognitive impairment, much more common than multiple infarcts, which turned out to be a rare cause of dementia. This realization was a change from the past belief that dementia related to vascular causes was due to infarcts in the brain. Although this is a mechanism for vascular dementia, it is much more rare than white matter lesions. White matter lesions were further researched and a genetic link was found. Of the genetic causes, white matter lesions contributing to vascular dementia are most commonly related to cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy, also known as CADASIL. As a whole, white matter lesions are most typically due to the worsening effects of microvascular changes in the brain. Blood flow throughout the brain is controlled by certain autonomic processes, which when interrupted for any reason cause significant damage to the brain. This is explained by Barker et al. Ischemia is the defining pathological process in most types of vascular dementia, and is thought to contribute to the pathology and exacerbate the clinical manifestations of Alzheimer's disease. Patients with Alzheimer's disease have reduced cerebral blood flow. As the small vessels are damaged, the brain cells they support are likewise damaged via demyelination, axonal loss, and lacunar infarcts. Making matters worse, these lesions often grow in size as the disease progresses, leading to worsening of symptoms, especially in motor speed and executive functions. Clinical presentation. Although vascular dementia, like other types of dementia, may present with classic symptoms associated with dementia such as memory loss, decreased ability to perform activities of daily living, and irreversible changes, there are specific symptoms that can apply particularly to vascular dementia. These specific symptoms, according to Idacola, were outlined to be more representative of vascular dementia, which had previously been grouped with Alzheimer's in terms of clinical manifestation. Cognitive deficits, more commonly associated with cerebral vascular lesions, such as executive dysfunction and psychomotor slowing. The term vascular cognitive impairment, VCI, was introduced to better reflect the range of cognitive alterations resulting from vascular factors in particular. One of the most accurate ways to diagnose vascular dementia is to use brain imaging to confirm diagnosis based on symptoms. As explained by Idacola, the white matter lesions generally correspond to hyperintensities observed on MRI. Like an MRI, a CT scan may be performed to visualize structures of the brain. However, an MRI usually provides greater detail. Other assessments for vascular dementia include a carotid ultrasound to check for sufficient blood supply to the brain, neurological examinations to test for reflexes, coordination, and strength, and neuropsychological tests to assess memory, planning, and the ability to understand language and numbers. According to the Mayo Clinic staff, doctors can nearly always determine that you have dementia, but there's no specific test that confirms you have vascular dementia. Your doctor will make a judgment about whether vascular dementia is the most likely cause of your symptoms. Just as there is no definitive test for vascular dementia specifically, there are currently no licensed treatments for vascular dementia, making it unlike treatment for Alzheimer's dementia. And that's the end of my presentation. Thank you for listening.